In hair transplant surgery, two things are very important: grade of baldness in the recipient area and availability in the donor area. These two things are very important because a hair transplant starts in early 20s and goes to 80s. And what is happening from 20 to 80 is this will keep increasing. Baldness or balding area will keep increasing, and donor area will keep squeezing with the passage of time. Here is the role of doctor to hold up the donor area. And if you go for medical treatment for hair loss, what is easy to do to hold the donor area? It is very easy to hold donor area with the medical treatment of hair loss, because the hair on back of the head, they are very less sensitive to dihydrotestosterone comparatively, relatively, because when we say relatively, these hair are more vulnerable as compared to relative to these hair. These are more vulnerable relative to these hair, and these hair are more vulnerable or sensitive relative to the occipital hair on back of the head. So it is very easy to hold the hair on back of the head. We can save our lot of reservoir if the doctor is knowledgeable. Doctor knows this important thing. This is very important. So thing is, you need to hold the donor area and prevent big hair losses. Okay? If you are having relatively smaller bald area and big donor area, comparison will be different. Donor is big and this will be smaller one. You can do anything with that, even if you are less trained doctor. But you keep in mind, in any cost, you can expect that this will keep increasing, this will keep decreasing. Okay? One thing is to interfere with the donor area, with balding donor area, by giving medical treatment, finasteride minoxidil. You can do that. Even then, you will take care of selecting the procedure for surgery. In early ages, what do you want to do? You want to put most important hair means most permanent hair in the recipient area. And which hair are permanent on back of the head? Gather all bald people who they are in 80s or 70s. Gather them. Ask them to sit in front of you, facing opposite to you. You will see a strip of hair is left on back of the head. Only a strip of hair is left on back of the head. In all the bald patients, most of the bald patients in 80s. And you see that strip area is considered to be most permanent area at any age. If it is permanent at 80, it is considered to be permanent at 20 as well. So, in early ages, before 35, if you are intending to do good hair transplant for the patient coming in your office, you need to put those hair in the balding scalp. And what is the reason behind that? Reason behind that is to give a permanent hair in the recipient area who they will remain there for years to avoid disappointments. And this is the only way to do it, to save the donor area. You are putting permanent hair and putting medical treatment in to hold the reservoir of the donor area for a longer time, and at middle ages, like at 40s, late 30s, late 40s, middle 40s, mid 40s, what is meant and what is considered to be like about donor area is that in mid 40s the donor area or hair back of the head, they are considered to be permanent. At that age you can go for FUE treatment or FUT treatment. You are open to do it. So in early ages, a step method, and in later ages, FUE, and in between medical treatment will give you authenticity, will give the patient comfortability and trust in the hair transplant surgery, and he can enjoy a lot of hair in the recipient area in his whole life. Thank you very much.